Hi there, my name is Vic Veer. I'm an ENT consultant surgeon working with the NHS in central London. And in my last video, I forgot to say something. So I thought I'd just tag it onto this video later on in the week. I was talking in my last video about tongue-based surgery for obstructive sleep apnea. And I went through sort of like a ladder I have in my own head about trying to improve blockage occurring because your tongue falls back and blocking your breathing. And I talked at the start or near the start about radiofrequency ablation to your tongue base. And there are lots of other operations, robotic surgery, coablation, things like that. But I want to talk about some of the things that will happen after you have some of these operations. One is that if you're operating on the tongue, particularly with radiofrequency ablation and some of the other operations as well, things swell up before they get better. So they get inflamed and you can't breathe very well. Well, when I say that, you can breathe relatively well. There's a feeling in your head that you can't breathe well. So when anything swells up near this area here, near your airway, your brain is hardwired to really, really worry about you losing your breathing altogether. So any sort of vague obstruction, even a tiny sort of millimeter change in difficulty in breathing through your throat here, your brain goes into overdrive and says, oh my God, I can't breathe. We've got to sort this out. So when you operate on the tongue and it starts swelling up after the operation, it can be very disconcerting. And your brain will go, oh my God, I can't breathe. And you're telling everyone I can't breathe. You can breathe, obviously, because you're able to speak. And if you can speak, you can clearly breathe. If you do this, you're clearly able to breathe. It's just your brain telling you that you're really struggling. And that swelling is scary, really scary. So in situations like this, after an operation on your tongue, if people are out there and you're sitting at the end of your bed, and you say, I just can't breathe. You want to go to sleep, but I just have to go trying to breathe. In that situation, I tend to give my patients some dexamethasone or some steroid tablets. And the good thing about steroid tablets is that when you take it half an hour or so later, the swelling all comes down, you feel so much better, you can go back to sleep and everything's fine. The only minor problem with taking steroids is that it slightly slows down your recovery rate because you want there to be lots of scarring in this area and to tighten everything up. You don't want to stop the scarring process. So what I say to people is, if you need the steroids, use them, particularly if you can't sleep and you feel like you're struggling to breathe. But if you don't need them, don't use them because that helps your recovery. So if you have that situation, that's what happens. A lot of people worry about, what should I eat after these operations? If you looked at the back of your throat, you'll see this sort of white slough growing on the back of your throat. This is how the throat heals up if you have an open wound, but you don't want it to get too thick. A bit like in the tonsil video that I did, which I'll put up here somewhere. In that tonsil operation, if you get a lot of slough in that area, it's fine, it's how it heals up. But if it gets too thick, you get infections growing within it and it prevents the healing at the back of your throat. So actually you need to eat rough food, or as rough as you can manage, to scrape off all the slough and the dead bits of tissue at the back of your throat to stop it from collecting up and causing an infection. So I think years ago, doctors used to tell patients after a tonsillectomy particularly, have ice cream, soup, jelly, things like that. And that will help you stop you from getting a bleed. But actually we worked out that that's completely wrong. And the research now shows that if you eat normal food, particularly rough food, pizzas, healthy things, because everyone gets upset with me when I say pizzas, burgers and chicken nuggets and things like that. So healthy food, whatever you want to call it, something that scratches the back of the throat, scrapes off all this white stuff. What that does is it improves your risk of getting a bleed. So people who eat soup and jelly, their risk is about 1 in 25 of them having a bleed, needing to go back to hospital, having an operation, stop the bleeding 4 o'clock in the morning or something like that, or having a blood transfusion. Whereas if you eat proper food, normal food, the research shows that it goes down to 1 in 100, so 1% of people. So it's a massive difference between 1 in 25 up to 1 in 1,000. So yeah, definitely eat hard, rough food, eat a normal diet, healthy diet if you want, and get all this slough off, because that seems to improve the risk or reduce the risk of you having a bleed afterwards. The same thing happens with the tongue as well. So after a tongue operation, do try and eat. Don't just have soup and jelly. I will say, however, that ice cream is nice. It does help because the cooling effect is quite nice. So don't not eat soft food. Don't not eat ice cream, but just eat hard food as well, because that really helps. So that is the pain. take your painkillers regularly, and you'll see the tonsil video about taking your painkillers. But there are some times when I've just had a patient a few weeks ago that had this problem. There is a time when, particularly with the tongue, that you can get such bad pain in your tongue, and the tongue is like, oh my God, what have you done to me? You've just burnt the upper layer of my surface, and what have you done? Instead of it being very, very painful, what it does is it cramps up and doesn't move, and just will not move because it hurts so much, and it just wants to hold on to it. Now that in itself is not terrible. That's how the body protects itself from broken bones, for example. All the muscles around it tighten up to stop it from coming away altogether. So your tongue spasms up, which is a relatively normal reaction. But what that does is that when you try and drink something or eat something, it ends up going down the wrong way. You feel like you start choking because you start aspirating on this fluid because none of the muscles are working very well. And you like, oh my God, what am I doing? It doesn't work. I can't swallow any of my tablets. I can't swallow any, can't eat or drink anything. And you get really, obviously, very panicky with this because the tongue has gone into a spasm and just won't work very well. Some people find it hard to stick out their tongue. Some people find it very hard to yawn like this because that's meant to open up the airway, and you're just sort of stuck with this weird spasm, which may or may not hurt. In different people, it affects them differently. If you have this is the bit I remembered at the last video, sorry. If you have this problem where it's spasming at the back of your throat, tell someone about it. Take your painkillers, that really helps. Take the steroids. Some people give diazepam. I'm a bit scared of diazepam because it's quite addictive. That seems to relax a muscle as well. Some people give buscopan. I don't think that works at all. It's never worked for me in the past. And buscopan is a drug that relaxes smooth muscle. And I don't think it works very well for voluntary muscle. Diazepam does relax you a little bit, but it's not great for people with obstructive sleep apnea. And generally, people having an operation on their tongue have obstructive sleep apnea. So what I generally do, and what worked for this patient of mine a few weeks ago, was to try and stretch the tongue muscles. So what you end up doing is sticking your tongue out as far as you can, sort of like this as much as you can, sticking it out and stretching it, maybe doing those exercises you'll see. I'll put those exercises up here where you're exercising your tongue and your throat muscles to reduce snoring and sleep apnea. So there's a approximately 50% reduction in sleep apnea. But it might also be useful for this situation where you've got spasm of your tongue after an operation on your tongue. Sometimes that doesn't work. And what I tell people, which is a bit disgusting, you get two fingers, put it down the back of your throat like this, and pull forward like this. And what that does is stretch that muscle a little bit and relaxes it. Sometimes I explain to people that it may be that the muscle is in so much spasm that the blood vessels can't get oxygen to it almost. And so stretching it out, it's a bit like having trigger points in your neck. The physios will sort of do this and be horrible to you and push their elbows or a spiky finger into your trigger point. And that opens up those muscle fibers and lets the oxygen go through. I'm not sure if that's correct. I'm no physio. But the same sort of thing seems to work on the tongue as well. If you put your fingers down your throat until it sort of feels like it's gagging, these people don't tend to gag very much because this muscle isn't working very well. And you pull forward like this and you stretch that muscle a little bit. That seems to relax that spasm a little bit. And you go, oh, that feels a bit better. Then when you drink, it feels like it's going down more. Sometimes, if you're really brave, you can pull it forward and rub like this. So you push your fingers in like this and pull this forward at the same time. So you're really pinching that muscle like this on the inside, like that, and sort of massaging it basically, or kneading it or something like a physio would do to open up that spasm. And that works very well. And then often you don't need so many painkillers and the throat starts working and the swallowing difficulties get better. Talking about swallowing difficulties, if you're having an operation not just on the lingual tonsil, but actually on the actual tongue muscle itself, where you're removing bits of tongue, which is a big deal. If you're doing that, there is a risk of us damaging the blood vessels and also the nerves to your tongue. So people have problems with, like, one nerve is damaged and it doesn't work very well, so it's off to one side. So there is a risk of that. Another nerve in your tongue is the nerve of taste. And that does happen quite frequently, where particularly if you're doing even minor operations on the back of your tongue, for a few days, sometimes a week or so, there is a problem where things just taste different at the back of your throat. So you drink something, you go, I think it feels different. It feels bitter or it tastes different, or I can't taste very well down there. It tastes of cardboard. That often gets better pretty quickly because you're not actually operating on the tongue itself. You're operating on the surface, and it just gets better with time. Sometimes, however, you can get an infection of that area. And rather than it lasting a week or two, it can last months. And you have to wait for the infection to go. And it takes about 3 months afterwards for the taste fibers to start working again. It's not very nice. It happens with tonsil problems as well. If you have a tonsillectomy, tonsils are taken out, with the infection of your throat afterwards, it can disrupt the taste fibers in that area. Again, with time, more often than not, the taste fibers come back. So in a typical person, the first few days after an operation, not too bad. I can still taste things. Everything seems fine. Then you get an infection. You're terrible for a few weeks, trying to take antibiotics, trying to get rid of the spasm, all that sort of stuff. And then when the infection goes, you still notice that the taste fibers aren't working very well. It takes a few months after that for the taste fibers to come back. I haven't met people who've had this long term, but it can happen. I think there's a 0.9% chance of it happening long term, but there is something like that. If you're digging into the tongue, obviously the risk is much, much higher because you may actually cut away at the tongue and the nerves and the blood vessels around it in that situation. Anyway, I hope you found that useful. It was just an idea I had. Do take care. Thanks very much. Bye-bye.